According to the Canadian Mental Health Association, in any given year, 1 in 5 Canadians are affected by a mental health or an addiction problem. Furthermore, roughly 500,000 employed Canadians are unable to work per week due to a mental health concern, and the effects on the economy due to mental illness are staggering. It is estimated to cost Canada $51 billion annually and can affect such things as healthcare costs, loss of productivity, and health related quality of life. Kim Willis is the Director of Communications and Healthcare Promotion for the Windsor chapter of the organization. She joined me this week to have an open and honest discussion about mental illness in our area and the resources available for anyone who may need assistance. I'm Kevin McShan. Let's have this conversation. Good, very good. So, Kim, if you're ready, we'll welcome you to the show, and we're excited to talk to you about some very important issues surrounding mental health this afternoon. Thanks so much for being here, and
Yeah,
thanks for a few minutes this afternoon.
of course.
So when we look at mental health across the region, certainly the coronavirus has affected all of us in some way, Kim. And I can only imagine that for those dealing with some mental health challenges, is that those problems have already been amplified because of the coronavirus. Would you agree with that?
I absolutely would agree with that. And I would add that these are unprecedented times for all of us. So the level of anxiety, depression, and even grief is significant for all of us right now. And as you mentioned, it's even more difficult if you're experiencing or living with a mental illness, because you might be feeling more isolation than what is healthy, just because of the barriers that we have in our lives right now. And we've also found that we were told to stay home, to stay safe. And consequently, some people have not reached out for help the way they would before the pandemic, just because they misinterpreted that message. So I think our health officials have backtracked on that a little bit, because it wasn't just those with mental illness, any other health challenges. People were not coming forward in April and May. And that's not what we want them to do. We encourage people to always come forward if you are in crisis and need help with your mental health and wellness. And I think just there's so much uncertainty in our world right now. And if you're experiencing anxiety and depression or any other types of mental illness, that can be an added burden and strain on you as well. And we have seen that the volume of our crisis calls is continuing to increase too. So we're certainly seeing an echo pandemic starting, which is a mental health crisis, and it'll be interesting to see what happens over the next year for sure.
And now, when we look at employment, your organization reports that at least 500,000 Canadians a week are affected by some form of mental health issue that would prohibit them from working at full capacity. So when you look at the mental health, the pandemic, and then working, how do you think those issues have intertwined during this time?
Right. So that's been a consistent number for many years in Canada. And it hasn't changed during the pandemic. I think what has changed is that more of us are working from home. And that has presented its own set of challenges, when it comes to focus and time management and productivity. I think all of those weigh on our mental health. But certainly, that number has remained consistent. And to address that, one of the things our branch has done is recently we introduced On the Front Lines, which is phase 2 of our Soul Focus project, which is all about education, training, awareness, addressing stigma, and the importance of early intervention and education. And coincidentally enough, we launched On the Front Lines a week or so before the pandemic outbreak in March. And because we knew even prior to the pandemic that workplaces in particular experience significant mental health challenges, just like any other organization. So On the Front Lines is geared to going into workplaces, meeting people where they're at, providing them with education and tools to support their mental health and wellness, encouraging adoption of a psychological health and safety framework, and educating HR and management about how they can be supportive of their staff to ensure they're mentally healthy. Because we know if the pandemic has taught us at least one thing, is that we know there's no health without mental health. And increasingly workplaces are recognizing that, but through this campaign, we're hoping to really move the bar and do our part to lessen that 500,000 number a little bit.
And for employers that may want to take advantage of On the Frontline program, how can they do that?
Yeah, we would love to be bombarded by requests, and they can reach out to me and at CMHA. Go on our website, Windsor-Essex.cmha.ca, and you can find information there. But we certainly welcome the requests from these workplaces.
And I'm just curious to know, obviously your organization has several resources and services, but I'm also curious to know, before I ask you about local resources that are available, what, if you had a magic wand, I guess, what would be your wish in terms of additional resources in order to tackle this problem?
Well, that's actually an easy question, and I would adamantly say additional funding from the government. The government, as you know, funds our healthcare system, and while gains have continued to be made across the system, it has not kept pace as it relates to mental health and addiction. So it's a very small percentage of the healthcare budget in Ontario, for example, and really to meet the demand and the growing demands that we anticipate due to COVID, we really need additional investments in our system.
And where do you think the biggest investment is needed?
I would say frontline services for sure. That across the board, we see wait lists. We know the demand outweighs the current capacity. And although in Windsor and Essex, we have been very collaborative with our partners, such as Hotel Dieu Grace Healthcare, Family Services Windsor-Essex, Windsor Regional Hospital, that only takes you so far. And we really need some more investments to meet the demand. So we don't have people on wait lists because we know that's less than ideal if you're experiencing any type of mental illness.
And what would you suggest for anyone dealing with these issues or challenges? What services would your organization offer them, and how can they get assistance locally?
Yeah, so at CMHA, Windsor-Essex, we have over 20 programs and services. And what we were able to introduce within the last couple of years is what we call coordinated access. So you call one number, 519-973-4435, and that individual that you speak with will listen to you, do an intake if that's applicable, and then match you with a program or service in the community that will best meet your needs. So what's nice about that is it's one number, and they can align you with a program at CMHA, or it might be at Hotel Dieu Grace Healthcare, or it might be with another provider in the community. So it's like a one door, one-stop shopping, if you will. But also, since COVID, actually, we've been able to introduce a couple of really great initiatives as well. The first being the Mental Health and Addictions Urgent Care Center, which is located right here at CMHA, 1400 Windsor Avenue. It's open 5 days a week, and it is a partnership with Hotel Dieu Grace Healthcare. And you can walk through the door any of those days, and a multidisciplinary team is on site available to see you. So what it's meant to do is prevent people from going to the ED. Now, we're not saying never go to the emergency department if you're having a mental health crisis. If it is a true crisis, if you're at risk or a danger to yourself or others, we certainly say go to the hospital. But if it's something less crisis driven, then you can come through the urgent care center. And like I said, there's a team that includes a registered nurse, therapist, social workers, there's even psychiatry. So that is free. You don't need a referral. You can just come through our doors and access that program. And that was introduced just after COVID started, because we knew that at the best of times, an emergency department is not an ideal place to go if you're having a mental illness episode. So that's been great that we've been able to introduce that service. And recently it's even been extended by through till October, with the hopes that it will be a permanent service in the community. We've also added a pandemic response therapist. So in large part, thanks to the Toldo Foundation, we were able to quickly hire this person in this role, and they are able to see anyone dealing with heightened anxiety, depression, grief, anything related to the pandemic that has caused their mental health to suffer. And again, you can call CMHA to make an appointment to see that individual. And I think grief is interesting because not only are we having to grieve for individuals that have died during this period very differently because of the lower numbers that are able to attend or visit a funeral home. So we're not able to say a goodbye in the traditional ways. We're not able to see all of our family members. So I mean, that has a profound effect on family and friends. But also, we all have some grief about the lives that we've lost due to the pandemic. So whether that's being able to go to your gym for your daily workouts, or the vacation you weren't able to take, it's been hard on all of us as it relates to grief. And we also offer a lot of online webinars that are free of charge to anyone in the community. We quickly pivoted to offer those. We see CMHA as the lead provider and advocate of community mental health services in Windsor and Essex County. So we wanted to be a responsible partner and let people know that they're not alone, and provide them with some education and information. And then most recently, we have hired a workplace outreach worker. So again, this goes along with our On the Front Lines campaign, but we're actually excited that this individual will be able to physically be on site at various workplaces on a rotation basis to provide additional supports. And again, it goes back to meeting people where they're at and removing yet another barrier to access services. So lots and lots of great programs and initiatives happening.
Indeed. Now, I'm also wondering for any family member who may want to support a person dealing with mental health challenges, what would be your message to them so that they can maximize their potential assistance?
Yeah, for sure. First and foremost, it's so important to talk, and that communication is so important. And recognizing if someone has changed their behaviors or their attitudes, or you know that they're struggling with some from mental health issue, is to initiate that conversation. And then if you're not able to provide the supports or what you feel they need to stay healthy, then reach out to a provider. And in a lot of instances, people might start with their primary care physician, but I would also encourage anyone who's struggling to visit the CMHA website, and there's resources available there too. And again, family members are able to contact that coordinated access line and see what might be available as far as supports in the community go. Also, there's more online resources and programs available than ever before. And the province of Ontario has certainly invested in this since the outbreak of COVID. So programs like Bounce Back are really excellent. It's a series of workbooks and modules that you work through. You have a coach that you check in with. So there are lots of things that are available, but certainly my first biggest tip is just communicate. Do not ignore someone that's in crisis. And if you yourself aren't able to provide them with what they need, find a program or service that can fit their needs.
Now, for people with disabilities, certainly dealing with social isolation may be a big part of going through this time and not being able to connect. So I'm wondering, for people with disabilities, as people in general, how important do you think it is to build a virtual network of support?
It's critically important. I think one of the biggest mistakes made as it relates to COVID is when the health units and different bodies use the message of social distancing in the beginning. And you still see that used, but increasingly we're using physical distancing because the intent was never to keep people socially disconnected. We are, as humans, are social beings, and connection with others is part of our makeup, what keeps us mentally fit. And having that network around you is so important. And although we have to meet differently, we still encourage people to find ways. And at CMHA, we actually started a campaign called #KeepConnected and showcased different ways that people can stay in touch during this pandemic. And especially in the early days when we weren't able to see each other face to face. It's a little easier now because we are permitted, the group size has increased a little bit, and as long as we practice the safety protocols, we're at least able to see people, albeit 6 feet distance, wear a mask, all that good stuff. But always, those social connections are crucial. And we know that if you're dealing with a mental illness and or addictions, that isolation can be really problematic. So certainly encourage use of technology like Zoom or Facebook groups or
like we're doing today.
exactly. It's so important, and I can't stress that enough.
And then finally, what would be your parting message to anyone who may be finding this time challenging to get through?
Well, I would just keep perspective and know that we are all in this together, and we all have a responsibility to do our part to keep each other safe and healthy. And I would also encourage just kindness and empathy, that this is a new situation for all of us, and there's frustration, and we become impatient. And I think you just have to keep it in perspective that we are all in this together, and to be kind, be humble. And also, I always mention to people that, at the start of a week or start of a month, make a note and write down 1 or 2, 3, 5 things, whatever, of things that you enjoy, that you can do for yourself to make you feel better. I think we all need to give ourselves a little bit extra self-love these days, because these are unprecedented times, and we all need to do our part.
Kim, I really appreciate your time this afternoon in tackling a very important issue here locally, here in Windsor-Essex, and across the country. So I want to thank you for your time this afternoon, and thank you for joining us as well.
Thank you.
Fantastic.